Remote patient monitoring is a valuable program for remotely monitoring patient vitals. In this video, we'll go over the general rules and requirements of remote patient monitoring so that you'll be set up for success with the program. Hey, this is Seth from ThoroughCare. We specialize in helping practices manage, bill, and streamline reimbursements for value-based care programs like remote patient monitoring. While we aren't going to discuss the CPT codes in this video, you can check out our video on the current billing codes for RPM right here. So what are the provider requirements for remote patient monitoring? First, let's talk a little bit about the program. RPM allows providers to remotely manage a patient's vitals. Medicare designed RPM as a general telehealth option for its insured population. Through various digital devices, doctors and healthcare groups can collect and analyze patient vitals on an ongoing basis between regular office appointments. By offering remote patient monitoring services, providers help to prevent health complications in patients by lowering the severity of the condition and reducing unnecessary visits. There are many symptoms and conditions that can be tracked through remote patient monitoring, including high blood pressure, diabetes, weight loss or gain, heart conditions, COPD, sleep apnea, and asthma. It's important to keep in mind that RPM devices must meet the Food and Drug Administration's criteria for a designated medical device. Many of the devices that patients will use may be familiar to them, including but not limited to weight scales, pulse oximeters, blood glucose meters, and blood pressure monitors. Now that we know more about remote patient monitoring, let's discuss the rules and requirements associated with it. On a monthly basis, patients must receive at least 20 minutes of service and/or providers must record 16 days of medical device readings to qualify for reimbursement. RPM digital readings can include weight, blood pressure, blood glucose, and heart rate. Prior to billing for RPM services, an initiating visit is required for new patients or patients who the provider hasn't seen within 1 year. The provider must also get the patient's written or oral consent before billing for the program. This is to make sure the patient is aware of such factors as possible cost-sharing responsibilities and to let them know they can stop the RPM services at any time. As for the devices, they must be provided to patients at no cost. In addition to the general rules and requirements of the program, it is important to know who can bill for RPM care. A patient's primary care physician or non-physician practitioner, think PA, NP, CNS, or CNM, can all bill for these services. As you can see, there are many important factors to keep in mind when offering remote patient monitoring to your patients. If you're interested in how ThoroughCare can help you set up and manage your own RPM program, please reach out using the link below. So there you have it. Click like and subscribe to our channel to learn more about the many value-based care programs we offer. Thanks for watching.